Are you having a dry cough? A dry cough intermittently. You have taken all the medications that you know is not going. Are you having it? Do you know that you might be having uh, uh, tuberculosis? Do you know you might be having tuberculosis? Now, what could be the cause of tuberculosis? It's a microorganism bacteria. However, something could trigger it. So if you're having constant cough, dry cough, sore throat, you have taken medications that you could, it's not going. First thing that I will advise you to do is go for HIV test. That will come out negative. Congratulations. Then the next thing you need to do is go for TB test to confirm you have tuberculosis or not. If you have it, treat it. But if you have TB and you have HIV, then they need to find a way to reduce the viral load of HIVs in your body before you could be able to, deal with the tuberculosis. So if you have any question regarding to what I've just said, or you have any question regarding to medicines, you can just send it to me on WhatsApp or leave it in the comment sections. We're going to reply you. Bye.